Do you think there's any videos up there? Well, I may know where to find some. Where? Where? Wait. Where? It's Medical Monday.
Put your head between your knees.
Dr. Grant, my dear Dr. Sattler, welcome to
Medical Monday.
Yeah, it's Club National Underground Thunderbounds when I stop the ground like a million elephants, a silverback orangutan. You can't stop a train. Who wants some? Don't come.
What's up, friends? Welcome to Medical Monday. So today we're going to talk about STEMI criteria, specifically what EKG findings designate something as a STEMI and really should prompt you to notify the hospital that you're bringing in a STEMI. So we're going to further define that. We've had a few issues with some hospitals and taken a few OOPG calls. People are just unsure of whether their EKG is a STEMI, so this should help define that a little better. This will be a two-part series, so this week we'll go through sort of the universal criteria, and then next week we'll get Dr. Vera to talk about some of the more complicated EKGs, Scarbosa criteria, things like that, and should help you sort of smooth all that out. So let's get started. Boom. Basically, this is the universal STEMI criteria. These are the EKG findings that you can apply to most of your EKGs that will help guide you in designation of a STEMI. For us in the field and pre-hospital world, this sort of guides when we activate the cath lab from the field. It's something that we want to promote because we know that field activation is important. It's important because time is muscle. We want to get these people to the appropriate care as soon as possible. So the first sentence is ST elevation at the J point in 2 contiguous leads. And before I get into the nuts and bolts of the criteria here, I want to define this sentence a little bit more. So let's do that. So the first part of this sentence is ST elevation at the J point. So let's break this down a little bit. ST segment is the section of the EKG between the end of the QRS complex, right? So specifically at the end of the S wave and the beginning of the T wave. And basically this represents the interval between ventricular depolarization, which happens here, and repolarization, which happens there. In most cases, it should be isoelectric, so it should follow along this same line. And in cases where it's not, where we do see elevation and or depression, these are pretty commonly caused by myocardial ischemia infarction. So this is sort of what we want to focus on. Where we measure this elevation is called the J point. And so basically this J point is the junction between the end of the S wave and the beginning of the ST segment, right here. That's where we measure ST segment elevation. We need to be able to measure this ST elevation in 2 contiguous leads. So this is the second half of that sentence. What are contiguous leads? Well, essentially they are leads that are measuring a part of the heart that are next to one another, anatomically speaking. And so we've probably all seen some variation of this chart, but essentially your contiguous leads would be your lateral leads, 1 in ABL, your inferior leads are all contiguous, 2, 3 in ABF, your septal leads are contiguous, your anterior leads, and your lateral leads. You know, one of the ways I sort of memorized how the 12 lead breaks down, I don't know if everybody has a way that they use to memorize this, but I was taught this and it just stuck with me. But I was taught big lie, little lie, ass backwards, and all. That's just how I memorize things, and it has stuck with me for years. So maybe if you're having trouble memorizing it, that's a little trick that'll help. So in addition to our contiguous leads, anatomically speaking, which is sort of demonstrated by this chart, our precordial leads are also contiguous if they are next to one another on the patient's chest. So obviously V1 and V2 are contiguous. Also V2 and V3, which are next to one another, are also contiguous. Same thing goes for V4 and V5. V4 and V5, right next to each other, they are contiguous. So now that we've sort of defined what this first part of the criteria mean, the bullets below sort of define the criteria for ST elevation that meets this STEMI criteria. The biggest difference in all three of these bullet points is found in leads V2 and V3. These are leads that may have some normal ST elevation found in them, which is why they require a little more definition. So in V2 and V3, if you are a male and you are less than 40, we'd expect to find 2.5 millimeters of elevation to meet STEMI criteria, so 2.5 boxes. If you're greater than 40, 2 millimeters of elevation in V2 and V3, 2 boxes, little boxes. If you're a woman, 1.5 millimeters of elevation in V2 and V3, so 1.5 boxes. All your other leads, just 1 millimeter, 1 box of elevation in all your other leads. If you have these findings in 2 contiguous leads, then you have met criteria for a STEMI, and you should call the hospital and let them know, and also transmit your 12 lead to them so they can sort of get the ball rolling. Alrighty. Alright, so that's it for this week. Tune in next week. We'll continue our part 2 of this series, getting into some more complicated EKGs. Have a great week, everybody, and we'll see you next week. See ya.
I'm a pretender.